In late 2019, as the world celebrated, a mysterious illness emerged in Wuhan, China. Doctors noticed severe pneumonia cases that didn't respond to usual treatments, something new and alarming. Early reports linked the illness to a seafood market, but details were scarce and confusing. The virus, later named SARS-CoV-2, spread silently. People could transmit it before showing symptoms. It traveled undetected, crossing borders as people boarded planes, carrying the virus worldwide. By January 2020, cases appeared in Thailand, Japan, South Korea, the US and Europe. Life continued as normal for most, with the threat feeling distant and abstract. Governments tried airport screenings and travel advisories, but the virus was already too widespread. Initial responses were marked by denial and hesitation, allowing the virus to gain a foothold. The window to contain the outbreak was closing rapidly. What began as a local emergency was quickly escalating into a global catastrophe. The world stood on the edge of a pandemic that would change daily life for billions. SARS-CoV-2 was a master of transmission, spreading through the air in droplets and aerosols. Asymptomatic carriers made it nearly impossible to track, turning everyday interactions into risks. International travel accelerated its spread, reaching nearly every country within weeks. Health systems were caught off guard, unprepared for a virus that moved invisibly. The virus used spike proteins to invade human cells, causing symptoms from mild coughs to severe organ failure. Its unpredictable effects made it hard for hospitals to plan and for the public to grasp the danger. Decades of ignored warnings and underfunded public health left the world exposed. Stockpiles of masks and ventilators were inadequate, and global health infrastructure was fragmented. The virus didn't need to be the deadliest, just highly contagious. It exploited our social nature and global mobility, thriving on our connections. The pandemic revealed the vulnerabilities of our interconnected world. SARS-CoV-2 became the defining crisis of our time. The world was forced to confront a new reality. By March 2020, COVID-19 could no longer be ignored. The World Health Organization declared a global pandemic, triggering lockdowns worldwide. Cities fell silent, landmarks emptied, and daily routines vanished overnight. Schools and businesses closed, and millions shifted to remote work and learning. The great stillness was surreal, a collective pause filled with anxiety and uncertainty. Lockdowns aimed to flatten the curve and prevent hospitals from being overwhelmed. Homes became offices, classrooms, and gyms. Digital life replaced in-person interaction. The shutdown exposed deep inequalities, especially for those without access to technology or safe shelter. Economic and social consequences were immediate. Businesses shuttered, jobs vanished, and supply chains fractured. News briefings became daily rituals, tracking infection rates and death tolls. The world waited, hoping drastic measures would work. The shutdown bought time, but at enormous cost. The future had never felt more uncertain. As cities grew quiet, hospitals became battlegrounds. ICUs filled rapidly, and staff faced impossible choices about who would get life-saving care. Shortages of beds, equipment, and protective gear pushed healthcare systems to the brink. Doctors and nurses worked exhausting shifts, risking their lives daily. Many patients died alone, with only a nurse or a video call to connect them to loved ones. Healthcare workers became surrogate family, offering comfort in final moments. The trauma left deep scars on medical professionals. Routine care was postponed, creating a backlog of untreated health issues. Fear kept many from seeking emergency care, even for serious conditions. Hospitals, once places of healing, became places of fear. The fight was not just against the virus, but to keep the entire system from collapsing. By 2023, COVID-19 had claimed over 20 million lives worldwide. Each number was a person, families shattered, futures lost. The economic fallout was immense. Global recession, shuttered businesses, and millions unemployed. Supply chain disruptions led to shortages of essential goods. Small businesses closed permanently, and financial hardship spread. Governments scrambled to provide relief, but recovery was slow and uneven. The pandemic widened the gap between rich and poor, exposing economic fragility. Mental health suffered, anxiety, depression, and loneliness soared. Young people faced disrupted education and social development. many survivors developed long COVID, with lingering symptoms for months or years. The invisible wounds, mental and physical, were as damaging as the visible ones. The pandemic's legacy was one of loss, hardship, and ongoing struggle. Amid despair, science offered hope. Researchers worldwide raced to develop vaccines, compressing a decade of work into months. By late 2020, the first vaccines proved safe and effective. By early 2021, shots were given. Vaccines prioritized healthcare workers and the vulnerable, marking a turning point. The rollout was a massive logistical challenge, but millions of lives were saved. Immunity from vaccines and prior infection reduced severe disease and death. Breakthrough infections happened, but vaccines made COVID-19 manageable for most. However, vaccine access was unequal. Wealthy nations secured doses first, leaving poorer countries behind. This inequity slowed global progress and allowed the virus to mutate. Still, the vaccine effort showed the power of scientific collaboration. Vaccines became the world's shot of hope, lighting a path out of crisis. The world after COVID-19 is fundamentally changed. Remote work became mainstream, reshaping cities and daily life. Public health moved to the forefront, exposing years of neglect. Investments in disease surveillance and preparedness increased. Agencies adapted protocols, and society embraced new health habits. COVID-19 didn't disappear. It became an ongoing threat, especially for the vulnerable. Annual deaths declined, but vigilance and booster shots remain crucial. The pandemic taught hard lessons about global cooperation and scientific innovation. Clear leadership and community resilience proved essential. The crisis revealed our vulnerabilities and our capacity to adapt and endure. The memory of the pandemic urges us to be better prepared and more united. The world of 2026 carries the scars and lessons of COVID-19, shaping our future.